Compared to kind of 15, 20 years ago, what do you think are the challenges that frontline staff face in the NHS at the moment?
I think the challenges are by and large the same. 15 to 20 years ago, I was one of those frontline staff really working really hard day to day. I think the pressures are very similar. The environment is probably slightly different. The expectations are often higher. And of course, we've now got vastly advancing medical technologies and people can survive for a lot longer. So I think that puts additional pressure. But by and large, they are very similar pressures to the ones we faced 15 to 20 years ago.
So Bruce, anything else that you think has differed, maybe just in your career as a surgeon, for example?
Well, I would agree with Jane about changing expectations, and those expectations cover patients, they cover professional expectations, but where I think things have changed is that there is a greater scrutiny from the media that didn't exist before, with a deeper understanding of healthcare issues and the politics that surrounds it. At a more practical level, I think the technology which is around to support in particular junior doctors at the moment has changed dramatically. I mean, there was a time when I was an SHO where to measure potassium you had to go to a little room off the main corridor in the Hammersmith Hospital and stick serum into a flame photometer, whereas now there are massive diagnostic arrays that are available to people both in the laboratory and in radiology. And I think people's expectations of interpretation of those has changed, and people's expectations of how quickly people can act on diagnoses has changed. For the better, of course, but I think it's putting a significant demand on both medical and nursing staff in hospitals in particular.
And can I just add to that? I can remember not that long ago, really, where if you were a type 1 diabetic, you had to boil your own syringes and needles. And if you talk to staff now, they would never think that was even possible. And yet I can remember doing that, when I was 19, 20. So I think there are some significant differences. There's also some differences in how people learn to live with long-term conditions or problems that in the past would have been death sentences that no longer are. And I think some of that has completely changed the focus of care we can provide and should provide. And again, that probably does put much more pressure on staff that maybe wasn't there many years ago.
But Jane, you raise, I think, another really important issue. So when I was a medical student, if somebody had diabetes, they were admitted to the hospital, they were seen by a consultant, the diagnosis was dealt with by the consultant. He would often determine the initial dose of insulin, and then, of course, by the time I was a registrar, it was being dealt with largely in the community by GPs and to a lesser extent by people in hospital. And now, of course, this is clearly an issue that's best handled by the people that have the condition.
Absolutely.
And so one of the things that I think the NHS is going to have to grapple with is how we support and provide information for people to be their own agents of healthcare, if you like, because and technology will be helpful in that. So it's odd, isn't it, that people run their social lives, their financial lives, their travel and everything online.
Using technology.
Yeah, and yet for some reason or other, healthcare hasn't quite got into that place yet. But I'd put it to you that for the younger generation, over the course of the next decade, healthcare is going to slowly transform into a knowledge transfer business rather than just a sort of paternalistic delivery service.
I absolutely agree with that. And actually the shift from that paternalistic approach to care to actually respecting that individuals can make decisions about their own life and their own lifestyle and actually manage their conditions themselves has been quite a significant shift. So yeah, absolutely, I completely agree with you.
So given some of the challenges that have been discussed, in your time out in the NHS visiting frontline staff, or your experiences in some of the bodies and meetings that you go to, have you seen any examples of things where you've gone, wow, actually that's not something I thought of, that's something that actually could make a real difference, and something that is worth spreading to others?
Well, I've seen countless examples of things like that. The interesting thing is they come from places that you don't always expect. So they'll sometimes come from junior nurses, junior doctors, sometimes from the more senior people, but often from people who work in other services. Porters have come up with some really good ideas about how services can be delivered differently. And that doesn't surprise anybody who works in the service. The thing for me, I think, Jane, is how we give organisations and people in a really difficult environment the permission to implement the sorts of ideas that largely the younger generation are coming up with. Because there's a risk, isn't there, that when the economic going is rough, that innovation in the public sector sometimes gets stifled. People go, oh, you know, now's not quite the time, we don't have the money, you know, let's not rock the boat. When actually, that's exactly the time
when they
to have the new ideas
and
rock the boat and be disruptive. And we also have, we need to give people permission to fail with those ideas.
You're absolutely right, and I love. There's a Helen Bevan term called, you know, how to rock the boat but stay in it, which she's used with our caremakers quite a lot, and those caremakers are often the people that think of new ways of doing things and new ideas. But I completely agree with you. You know, I spend loads of my time out amongst the frontline staff, looking at the way people do things, and sometimes it's what would appear to be the simplest idea that can have the biggest impact. And I guess the one that is top of lots of people's minds at the moment, and one that's certainly all over the place on Twitter, is the idea that Kate Granger had around "Hello, my name is," and it started as, you know, it started from when she was a patient, and her writing about what it felt like to be a patient, and how doctors and nurses and other staff didn't introduce themselves, and how that sort of was like dehumanised her and made her feel really even more vulnerable than she felt anyway. And so something as simple as saying, hello, my name is, which she put out via Twitter. And for those people that look at Twitter can't have failed to have missed it. But it's had a massive impact across the country. So I think, yes, we need to think about innovation and really innovative ways of doing things differently, but also sometimes just learning from some very small examples that can make such a big difference to the people we look after.
I agree. There's a bit of me that, I mean, I think what Kate's done is absolutely fantastic, but there's a bit of me that's saddened by the fact that somehow or other the environment in which people work enables them just to forget basic courtesies that you would extend to anybody that you met in a social environment. And to be able to correct that, I think, has to be one of our priorities. Indeed, it's one of the issues whenever you and I get called in to deal with difficult problems. There's always just some issue about people not being nice to other people.
Exactly. And one of the things that we know, we've done so much around the 6 C's and compassion in practice, which is equivalent to absolutely everybody, whatever job they do, is actually that compassion and that care to each other, as, you know, healthcare professionals or NHS staff, as much as it is to our patients, because we look after ourselves well and we look after our staff well, and they feel good about the jobs, they feel good about what they do. That inevitably has a very positive impact on patients.
Yeah. One of the going back to the original question about ideas. One of the things that worries me is that for so long, the NHS has kind of waited for ideas to come down from above, and the reality is that the solution to many of the problems in the NHS, if not all of them, actually lies in the intellectual capital of the 1.4 million people who work for the NHS. And my question is, have we historically valued that enough? I don't know, for example, how well have the ideas that come from junior nursing staff been really valued? How much have we really listened to ideas that have come from junior doctors, for example?
Probably not as well as we should, but I think we've got an increasing cohort of junior doctors, junior nurses, junior therapists who feel able to talk about what they're doing. And so the people that worked on the Keogh reviews, the people that are now supporting CQC reviews, the caremakers, many of whom are junior nurses and beginning to have junior therapists in there, I think are now feeling much more able to speak up and talk about ideas and think about new ways of doing things.
Yeah, I agree. And it seems to me that one of the differences, certainly in medicine, between my generation and the younger generation is the younger generation are much more prepared to speak up.
Yeah.
There was always an element, I suspect, when we trained about don't rock the boat, just toe the line, all of that sort of stuff, which was absolutely the wrong place to be.
Yes. I remember well being shouted at for sitting on the bed talking to a patient when I was a student nurse.
Oh, sitting on the bed was a real no-no, wasn't it?
Yeah, it was. And how dare you sit on the bed and talk to your patients? Haven't you got beds to make?
So one of the other things that strikes me is it's quite a tribal system in the NHS, and so you've got various tribes, but within those tribes there's a kind of massive hierarchy, isn't there? So one of the things that bothers me, certainly among junior doctors, and I don't know to what extent it applies to junior nurses, but we have 50,000 junior doctors who move from hospital to hospital.
Yeah.
So they know where the good stuff is, and they know where the really bad stuff is. And we should really be using them as some of the biggest change agents in the NHS. And I find myself wondering whether with nurses, they don't move from hospital to hospital as much, but they certainly move from ward to ward and practice to practice. And
well, student nurses can move from hospital to hospital and different settings, and they certainly move around within hospitals quite often. And I think, so absolutely, they are the change agents. And I think, for me, that was one of the most powerful things about NHS Change Day last year, was it started off with a few people. It started off with frontline staff talking about it, and it just extended to so many people and sort of almost lit a fire under so many people that felt, actually, I can say something, I can make a pledge, I can make a difference, which was just phenomenal. So
it would seem to me that as leaders of the profession, nursing, medicine, that we should be thinking about how we listen increasingly to the younger generation, because they have to live with the decisions that we make about the service.
Exactly. So maybe we could have some junior doctors as caremakers as well.
So Jane, what would that mean for junior doctors, for example?
Well, it could be junior doctors, it could be qualified, or it could be consultants, or it could be medical students. But what it means is they would join a network of caremakers across England. And at the moment we've got 600. We're planning to have 1,000 by the end of March. And they act as ambassadors for the 6 Cs. They act as networkers and people that really push the care and compassion agenda in their local areas. So these are nurses that will talk about the 6 Cs or about care and compassion within those wards or in those services or in their local communities. And it's really driving home that message that people do care about patients and do care about the care that they provide.
That sounds like a great thing to do. So it'll break down some of the tribal barriers that we've talked about. It'll get people working together with common cause on care and compassion.
Absolutely, absolutely.
Good thing to do.
Excellent.